Dr. Robert Karras opened his first walk-in urgent care clinic in 2008 in Lowell, Arkansas, and then opened one in Fayetteville in 2012. His background was largely in emergency medicine, but he quickly recognized that he was the primary care provider for most of the urgent care emergency patients that he was taking care of. And so the clinic name changed from Karras Urgent Care to Karras Healthcare. Recently, Dr. Karras has been seeing patients to assist them in getting them a medical cannabis card. And today we'll be discussing trauma, adverse childhood experiences, PTSD, anxiety, and cannabis. Welcome to the show, Dr. Karras.
Thanks for having me.
I'm so glad you're here. We've been mentioning your name in the clinic all this time, and so it's good to have you in person.
Thanks. Appreciate it.
And
been good.
Yeah, and the visit kind of came out of my visit to your clinic for my cannabis card, and we kind of got to talking about the patients that come to see you for the card, right? And so, what have you noticed about their, emotional status, diagnoses?
So I've probably done maybe 500 of them now, and,
Wow.
and probably 400 of them are for PTSD. And
Wow.
so that's been the most interesting part for me, and generally more with, most of them with anxiety and insomnia. If you have that for years, then you'll have other physical problems as well, a lot of chronic pain.
Sure.
And you just tell they're the type of patients that you can tell they're anxious to be at the doctors, and
Right.
so, but it's been a great experience, actually. It's really been interesting for me, and I think it's been really helpful to learn about this more. Like we'll talk about probably the ACEs, adverse childhood experiences, and how it affects people physically, medically, and that with talking with people, that people have just naturally gravitated towards marijuana as a treatment on their own, and now it's medically legal, so I think it's good.
Right. I've been saying for a long time that all use is really medical use. People are using it to sleep, to relax, like all the things that you mentioned, which it may not be considered a medical diagnosis for some people, but they're definitely using it for those reasons.
Right, and most of those people I see that I diagnose with PTSD, they may not have had that formal diagnosis, or they're like, wow, I didn't realize that was abnormal.
Right.
For my, or like, I just thought that was a normal childhood,
Right.
And so they didn't, they don't know that they have that diagnosis, or that those problems are related.
Right, or that it's an actual diagnosis.
Right.
So let's talk about this ACE, because that's kind of been a new measure that people look at, right? Adverse childhood experiences. And you've seen a lot of that, aren't you?
Yes, it was interesting. Like, I've only known about it for maybe 2 or 3 weeks, that term ACE. I was seeing a social worker who was there for a card, and she was talking about her PTSD from her work that she does with DHS. And I was telling her, what I've been seeing, and how most 80% or so is PTSD, and from usually a crappy childhood. And she's like, yeah, that's all the buzzword in sociology and social work is ACE. The Surgeon General in California has come out recently saying that everybody should be screened with the 10-point ACE questionnaire. And the questions that I was asking patients, did you have a traumatic childhood with any physical or sexual abuse, witnessing lots of violence, or parents that were alcoholics or drug addicts? And that's 5 of the 10 questions on the ACE set. And so, a lot of times people say, yeah, or this, or all 3, or something like that.
And 400 out of the 500 that you've seen have fallen into that.
Some of them have had other PTSD, maybe from VA, from veterans, from war and stuff like that, but the majority is just from childhood, yes.
It seems like childhood trauma has reached an epidemic level.
I don't know if it's been reached or it's just been exposed, I would say, probably. Probably is more the case.
Right.
I think, probably.
Yeah, that's probably true. Just like when we talk about sexual abuse, the reported figures are not the actual figures. Most people don't report. So when they say, for instance, with women, the statistic I think is
1 in 4.
1 in 4, right? It's probably much higher because people generally don't report it. And then for men, the statistic's a little bit lower than that, I think.
Yeah, and probably some just not reporting or not admitting, but it's
Right.
less common. The sexual abuse, I believe, is less common in men, or in boys, but still prevalent, or still crazy high.
Right. And some people don't even understand that their experiences were abusive and affected them in a profound way.
Right. The one article you sent me about the doctor from Tennessee that had an addiction treatment center, he screens all his patients that come in with the test. He gives it to him before he goes in. Then he goes over it one for one with him. Because, like, the one person was like, oh, well, I didn't know, watching my mom smoke meth every day was abnormal.
Right.
Everybody in the neighborhood, was doing that. So yeah, and then also, too, it's interesting that a lot of people don't want to say yes to that. I had a patient that was, was an educated person with a degree in social work, and I'd ask them my questions, and they said no, and we were talking about PTSD from another source, and I knew she was just a little more anxious than what I think you would have. Like, I mean, I think you could say, like, physicians working in the ER, or nurses working in the ER, firefighters, police officers, paramedics, they can all get PTSD from overexposure to trauma and terrible events, and that's what she was attributing hers to. And then I'd ask her the questions about childhood, and she'd answer no to them. And then I asked her, your child was fine? You sure that it was fine? And she said, oh yeah, actually my dad was an alcoholic, and I had to hide in my room so that when they were fighting or whatever. And so it's interesting. A lot of people just don't want to say. I mean, some of it's the wording we use for negative connotation of alcoholic or addiction.
Sure,
but people don't want to
right.
admit that, or they, the whole process is filled with shame.
Right,
And
right.
like whether it be the shame of like, oh, my parents or my dad was an alcoholic, or I was abused and I had
Right.
shame with that, or something
Right.
like that.
It's really good as a physician that you recognize that and that you dig a little deeper. Because I don't think that always happens. It's easy to kind of gloss over, and people do feel ashamed, or they don't know it's abuse. I know, I grew up, I was sexually abused. It was a terrible situation. As I was healing, I continue to heal from all that. It's a journey. It takes many years. I've run across many people who suffered sexual abuse, and some of which didn't know that that was abuse either, because of the norms in their family.
Yeah, it's
And I
crazy.
know, Topher, you studied anthropology, so you probably look at norms, and different societies have different standards for that. So people may have a bias and not realize that it's even an abusive situation.
Yeah, and like Dr. Kara said, with the semantics of it, of the negative connotations, and people don't want to put that on their life because it's a thing of like, oh well, that. I feel like a lot of people, when it comes to not recognizing abuse, especially in their childhood, they don't want to put a label of negative versus just a thing that just happened in my childhood. And so I think that also muddies the waters on really coming to terms with what trauma people did go through versus just experiences that they went through.
Right. I think for me, for a long time, I wasn't really outspoken about that part of my life. And going through the illness that I went through and being stuck in a wheelchair, I was in a power wheelchair, so it triggered all that old stuff that I thought I had worked through, because now I'm not in control again, of the situation. And I think I didn't put it all together until a few years later, that, oh, this is why I was so over emotional. I mean, you're already sick and on a bunch of pills, but add to that this abusive background, and it just makes everything harder and worse, harder to deal with, harder to treat.
Yeah, if you don't notice it or mention it or think that it's a problem. I did the test. I scored a 4. I call it a soft 4, kind of. But and then I was like, man, that's pretty high. If you looked at it, it puts me in increased risk for things.
Right.
So that's interesting. Makes me rethink, like, oh yeah, my childhood was fairly tough. I mean, it wasn't terrible, but it was not easy.
There
at
were
times
elements in there that might make it harder for you. Yeah. And so the other part of this is the substance abuse that comes along with it. So the patients that are coming also for the cannabis card, are you seeing people that are trying to deal with substance abuse who use it as an exit drug from alcohol?
Yes, not super common, but yes, today I had a patient like that, and he was hoping that this would help him with alcohol. Like he'd never used it, but again, people that drink a lot are doing that because they're anxious. A lot of times there are people who have a lot of anxiety and it calms them down. And so he was hoping that it would help with that.
And I think in the article that we shared, they were talking about comfort-seeking behavior,
Right.
right? Instead of calling it addiction.
Addiction, yeah. Do you remember exactly what it's called? It's like compulsive comfort-seeking behavior.
Yes, compulsive
So, yeah.
comfort-seeking behavior.
Yeah, which is exactly. I think it sounds. It's exactly what it is.
Right. And when you look at it that way and really look at with understanding someone, because I think we had talked, I sort of have a bias a little bit against alcohol. I've had different alcoholics in my life. It's not something that I was drawn to self-medicate, but it's a little unpredictable and scary to me sometimes when people overindulge. And yet I hadn't thought about this, that they are seeking comfort. They're trying to accommodate to a situation, whether it's caused, some social anxiety, they can help with that. Or,
Yeah, if you look at the destruction that's caused by alcohol, it's just that it's acceptable, right? How many people die every year? Over 10,000 drunk driving deaths a year, not to mention all the injuries. The liver failure, alcohol at any amount is a carcinogen, a known carcinogen. The World Health Organization put out a memo on that probably 2 years ago that got a lot of flack. But when you compare that with marijuana, where it really doesn't increase your cancer risk, doesn't give you COPD.
right.
All those things. And then also, too, I mean, from personal experience, I've been intoxicated and done stupid things.
And
they're
I
all
have
legal.
too. It's not like
but
I
it's
never drank, but
alcohol almost always makes you do stupid things.
Yeah.
Like, I don't know why, but you don't see that with marijuana.
Right. It lowers the inhibitions so much, I think, the alcohol. But
Spirits, they call it spirits.
But it is
And they're not good spirits.
but it is socially acceptable
Right.
and available. And so what do you think about the stigma of cannabis? You think it will start to lessen?
Yeah, I think so for sure, right? It's legal in 30 states medically, 8 states recreationally. We should have had a camera in my room. I had a patient that came in, an older gentleman, and hadn't slept well in decades, and his doctor told him he thought he should. His friend let him use a pen. He showed me a picture of it, and they said, I do 2 puffs of this every other night, and I'm able to sleep for 6 hours. I haven't been able to do that in 25 years. And I said, yeah, I've heard a lot of good, for sleep, for anxiety, I heard it's very good, for muscle spasms. And he's like, yeah, but you don't understand. And I'm like, what do you mean? Like he was ashamed that he was using it. He's like, I'm a Baptist minister, and so like, it's okay. It's,
Well, I think I feel like the stigma has lessened in some areas. I still feel it in Arkansas, not as much in Fayetteville, but I think that it's going to take more and more time. It was so demonized, and as people like ministers and people in positions of authority are like yourself are saying this is medicine, this is helpful. I think it does help, to reduce it. So how can people get in touch with you and?
Well, my cell phone, no.
If you want to give out your number.
Go to Caris Healthcare and look up our online and find our number and call, and you can set an appointment either at the Fayetteville Clinic or the Lowell Clinic. If you have insurance, we just bill your insurance for a normal office visit.
Which is amazing because, so not just in Arkansas, but all over the country, there have been many physicians who have very high charges for these visits, and they've made lots of money, and many patients are left behind. So it really has warmed my heart that that's not true at your office, that people are able to come in, and if they have insurance, they use it, and you've been very generous with Bulldozer Health also.
If you don't, then we charge you $100, but
which
we're
is still,
reasonable.
Right.
We'll
which
make
is,
payments or whatever. Yeah, I find it a little ironic, there's some people that have clinics in town or around the state that are saying how good marijuana is medically and this and that, but yet they're not billing insurance. They're charging you $250 to
Call
see
them out so people don't go there.
Well, I guess you just got, and that's why I decided to advertise on radio. I've advertised a little bit on radio. We've advertised through you.
Yes.
And I was like, well, they're going to, I think we'll do it. We'll do a good job, and we'll do it.
Right, and that's the other thing. So I know that there are pop-up clinics all over. I've been in many other states. where it is $250 up to $300
Yep,
even.
yep.
And really, they don't necessarily do a full exam, but I mean, going to your clinic, you're getting a full exam, you're talking with the patient, you're checking their vitals, and really
Yeah,
taking
it's a full
look.
exam, and then I usually spend 10 or 15 minutes, and it's usually, and so
Yeah.
it's a good visit, I think.
I think so. I think that's important because if we're really talking about medicine and medical treatments, we want to treat it the same way as anything else.
I'd recommend a lot of, look up some PTSD therapy or counseling in Fayetteville or wherever you're at. And, outdoor activity, physical activity, meditation, those things are all helpful for anxiety and for insomnia and for
Absolutely.
healing.
Cannabis balances your system, and then other health benefits can come, but it's really up to the person.
And it's there's multiple things you have to do to be healthy. I think there's not just one thing or.
Right. Absolutely. Well, thanks so much for being here. And if people are out of the area, still check out charishealthcare.com. And if you're in the area, the clinic's right here in Fayetteville
Yep.
and in Lowell,
Yep,
right?
yep.
Yes.